right, thank you for your patience. We have a really great roundtable today. I always like when we have panel discussions in addition to just one person. And so we do have that today. And, you know, coming along with having multiple people is multiple PowerPoint presentations. So we got that all set up for you today. For those of you that don't know me, I'm Eric from the Office of Global Learning. I'm having a horrible day today so far because Firefox lost all of my passwords and I don't know how to log into anything. So I haven't gotten anything done today. But that will officially change right now because a successful Tuesday Times Roundtable counts as getting something done, and I'm really looking forward to this one. So we have three amazing individuals here with us today. First and foremost, we have Betsy Suero-Skip, who is a social change advocate and consultant. She has her paralegal degree and is a longtime guardian ad litem, which is a fantastic position to stand up for the rights of children in our foster care system. No? I want to make sure I got that right. I know that by now. She serves on the Guardian Ad Litem Advisory and Recruitment Committee. She is the co-founder of the Promoting Academic Success Community Dialogue. She is district chair for CARE, one of the organizations being represented today, as well as global team leader for Results, another organization, and took the lead in putting together today's panel discussion. Our next person is Aleida Mejia. Sorry about that. Who is the Director of Global Health and Social Ventures at CappSci. She joined CappSci in 2012 to manage the development, implementation, and launch of a global $1 million competition focused on reducing child mortality known as the Children's Prize. She's going to talk about that today, I believe. And in her current role, she leads the organization's efforts to deliver high-impact execution of competition to reduce child mortality. And finally, we have Taraya Prochel, who has been working with CARE since 2008, managing their advocacy activities in the Southeast and parts of the Midwest. She has traveled to CARE projects in Peru, Haiti, and France. And prior to joining CARE, she worked with Chris Paz in El Salvador, leading delegations to post-conflict areas throughout the country. Her BA is in International Relations from University of Minnesota and has a JD from the St. Thomas School of Law. So I'm going to turn it over to Betsy to start, correct? And thank you all for being here today and to our panelists.
Thanks, everybody, for coming. As you heard, my name is Betsy Suero-Skip, and I would like to start off by really thanking Dr. Hillary Landroth and Eric Feldman for allowing us to be here today for the Global Tuesdays. Today we're going to have a round table here in our forum. We want really most of this to be about your questions and answers. And on taking action on U.S. foreign aid funding. And I'd like to say, to start off, that right now we're in the middle of appropriations. All the Congress people and citizens are out there asking for money for their own little project. Gun control, you name it, housing, everything else. But we particularly work on foreign assistance. And what we really strive for under that foreign assistance are the humanitarian causes that really, we believe, save people's lives and do good in the world. So we're also pleased to have CARE here, and Turi is going to talk about why women and girls play such an important role, why we need to fund programs for women and girls. I now call myself a citizen advocate or a citizen lobbyist, because that's what I'm doing. I go to Congress, I go to our Congress people, I go, I need your money to fund these programs. So don't be shy about using that word. I think it's a good word. Why not? People get paid to do it. We do it as volunteers. Now, you might, does anybody know what this picture says here? What do you guys see up there? Complete slum next to beauteous pool, tennis courts, etc. You might think that in some countries, what might you think of the title given to some countries, less developed or third world country? Does this create stigma? Does U.S. foreign aid funding advance U.S. global and domestic concerns, providing people with the tools to learn how to become self-reliant? Does U.S. aid encourage countries to engage government and civil society in strengthening new systems and infrastructures so they can pull themselves out of poverty. This is what we're going to talk about today. The world has become as one, accessible to all. What makes it even more important that the U.S. must remain globally engaged in order to support the worthy impact of U.S. foreign aid and its accomplishments. We must continue our engagement, and we must wisely use our economic leverage. So what do you think we allocate to foreign aid in this country? Anybody show of hands? How much do you think of our taxpayer funding goes to foreign aid? 20%? 50%? Nobody has a guess? Have a guess.
Less than 1%.
Close. Okay. Did you know that the entire international affairs budget, also known as the 150 account, is a mere 1% of the total federal budget, less than a penny on the dollar? We spend more on that on pet food every year. Now, the humanitarian causes that we really like to work on is 0.5% of that budget. However, why does the U.S. give foreign aid? For national security reasons, economic interest, or because it's the right thing to do? It has been argued that foreign aid is wasted on other countries when it should be spent to improve lives in America. But here's one example that some can't argue with. The fastest growing market of American companies is in the developing world. 81% of U.S. public holds, and then 81% of the U.S. public holds the view that developed countries have a, quote, moral responsibility to work to reduce hunger and severe poverty in poor countries. The international affairs budget leverages approximately 1% to support critical development and diplomacy programs around the world. Programs funded by the international affairs budget create jobs here at home by opening new markets to American businesses and protect our national security by fighting terrorism and preventing conflicts before they start. These effective, efficient investments are also staffs all U.S. embassies overseas, fights pandemic diseases, provides emergency response after natural disasters, implements agricultural programs to promote stability and prevent hunger, saves millions of lives with HIV/AIDS medications, improves immunization rates, and seeks to have every child attend school. These, to name a few, which provide essential good governance assistance to newly emergent democracies. Some people are also concerned that foreign assistance creates dependency, an argument that parallels criticisms of domestic welfare in the U.S. But foreign aid run through USAID programs is changing, especially in recent years, to focus on sustainability and long-term solutions. Some programs, although costly at first, can promote growth over the course of years. Rather than providing food, these programs help communities grow, market, and warehouse their own crops and provide entrepreneurial training to show people the importance of long-term investments. If we invest intelligently in foreign aid, we can capitalize on productivity and personal motivation within the recipient country. I suggest that we need to stop acting as if these investments don't matter, and that global threats to the environment, public health, and safety will somehow be solved by others. U.S. foreign aid has already gone through deep budget cuts, but by being informed, we can all become citizen lobbyists in support of a better world for all. The American people deserve to be told that disproportionate cuts in these strategic and life-saving programs would have no appreciable impact on the U.S. deficit, and in the end would end up costing our country far more capital, human and otherwise, in the future through rising costs associated with war, civil unrest, immigration, environmental degradation, disease, abuse of women and children, and other major problems. We Americans think we are the most generous country on earth. Let's prove that by providing more than 1% of our budget to foreign assistance. We have the numbers, we have the figures on the positive return of investment of foreign assistance. We can show it is an excellent investment, and we know what to do. Congress is now in the appropriations process. If this dialogue resonates with you, please contact your member of Congress and senator and ask for their support for robust funding in support of foreign aid. It will provide life-saving humanitarian assistance and fund development programs that foster growth, health, education, democratic governance, and poverty reduction. And that's it. And then I have one more. There's another one up there, just one little announcement. Results is giving what they call a real change organizing an advocacy fellowship to fight poverty for the summer. And it is a paid internship. So there's information up there, or if you go to the results website, www.results.org, you can check into it. Spend your summer in Washington. And thank you.
All right, so my name's Aleida Mejia, and I work for an organization called CappSci here in Miami. I handle the Global Health Program, and I manage a prize called the Children's Prize. I have to tell you that some of the things that Betsy brought up in terms of foreign aid are very, very real, not only in terms of government, but also private citizens. The person that I work for is a philanthropist, and we have this private foundation. And as a result of some hesitations on how, he's seeing money being handled, he decided that he wanted to approach his philanthropy in through a different perspective. And that was the birth of the Children's Prize. Basically, we put out a global call to the world back in 2013, and we said, for $1 million, how many children's lives under 5 can you save? That was the start of an awesome experience for me, I have to tell you. I got to witness the landscape of maternal and child health from a very high level perspective, seeing what people are doing on the ground, seeing, which is very hard work, seeing some of the solutions that they are proposing, whether it's super cool, innovative technologies or just very simple interventions as far as education, vaccines and immunizations, things that here, I guess, in the quote-unquote developed world, we somewhat take for granted. So as a result of some of this hesitation with foreign aid, providing funding to organizations that act as intermediary for work that someone feels passionate about. And I think this resonates with a lot of people. When you donate money, you want to make sure that you're helping. You want to make sure that you're making an impact. And so we decided to create this model of the Children's Prize to kind of address that and create a more direct approach between a funder and the recipient. So I looked up some statistics just to share with you because I didn't even know these numbers, and they're probably a little bit outdated because they're from 2010. But Americans, according to 2010 statistics, donate $30 billion through government to developing nations. And that's compared to I said 30, right? $30 billion. So that's compared to $39 billion that's donated through private philanthropy. In addition to that, there is $96 billion that individual Americans, mostly immigrants, tend to remit to families. They tend to send abroad to their country of origin or to where their families are living to help them with living expenses. So one of the things that the Children's Prize wants to focuses on is definitely conveying the impact of the work that we are funding. And that's something that's very essential to anyone that, again, provides funding to help other people in whatever, way they see fit. Some of the things that I want to talk about, and the reason why I thought this would be really interesting within the context of foreign aid, is because, many people feel demoralized. I want to say, why should I give my money if I don't even know where it's going, or I don't even know if it's helping? But the truth of the matter is that it does help. Systems that are built so largely do have to have processes in place. And I can tell you this now because I'm doing this work. You need to standardize systems in order not to show favoritism of some kind, in order to address things more effectively or efficiently. But in that process, you begin to kind of chip away at the unique relationships that you develop with organizations. Right now, the Children's Prize is very small. We have a portfolio of 5 winners, and they are in Angola, Uganda, Kenya, Pakistan, and Nepal. All of these projects have to do with maternal and child health. And some of the things that I want to bring up in relation or in contrast to foreign aid is this particular model allows for very direct connections, again, as I mentioned before, between a funder and a recipient. The perceptions of how money is spent is more easily accessible because we track individually what's going on. We have milestone points. We're not traditional in the sense that we hand over a check and we say, okay, once the project is done, come back or report to us. No, we stay with them very collaboratively. So we have, bi-weekly meetings, and we engage them. We try to find out what are the challenges in your process. What's a piece that's missing? So I'll give you an example. There's an organization called RISE, and they work in Angola. They were initially building out schools, and now they've started, actually, not in addition to building out the schools, to drilling water wells. And they started to see the impact that this access to clean water was having to the health of the children, meaning more children were actually going to school because they weren't getting sick. They weren't dying from cholera or diarrhea. They didn't have to walk kilometers after kilometers to fetch dirty water. So they started to see the impact of that, and as a result of it, we are funding them to conduct a study of the actual impact, so quantitative impact that they're making in the communities. The cool thing about this particular organization is the person that started it with a lot of passion, and she was just a practitioner wanting to make a difference. And as a result of this study, she's making connections now with people that have scientific, evidence-based background. So she's really learning about the process that she's undergoing. Again, it targets. The prize allows us, or the model of the prize allows us to target real needs. When we launched the $1 Million Prize in 2013, and we started to ask the finalists of that prize about the impact that they were making on the ground, it was interesting to see how they lacked confidence in those numbers. And we became curious around that, and we said, well, is there funding that is specifically allocated to help these organizations secure evidence-based research? Do people do that? And we realized that not many people do. Donors have this perspective, and I'm, widely stereotyping here, but for the most part, donors seem to think that they want their money to directly go to a program to save a life. but not much funding is dedicated to really look at what is effective and what is efficient. So in 2014, we ran another prize, and it was dedicated solely to that, to help people secure, pieces of evidence to help them understand if they're making an impact. Again, the virtue that you have people from all over the world applying, I think this is great because you're getting people that are already embedded in their communities. They have relationships there, so they know what the needs are. And more than likely, they kind of know how to approach them in terms of solving them. And the other, again, with that said, I have to tell you, there are challenges also to this. The scalability of this type of model is something, to be considered. And the other thing is, we're fairly young, so limited resources is another thing. And I just want to bring this up just to kind of juxtapose for you that there are other alternatives within the scope of foreign aid. We usually tend to think it's a government thing, but really it touches everybody. And from a private philanthropic aspect, I just want you to realize, that there are other options available that complement that model. So that's it for me. Thank you.
Good afternoon. Hello, everyone. My name is Taria Trochel. I'm the Regional Field Coordinator for CARE. As was mentioned before, I have been doing advocacy for this organization since 2008. It's been a great pleasure to get to work with folks from around the Southeast and get them involved in our political work. It's a very exciting opportunity to be a member of this country where we have the opportunity to speak with Congress, to ask for things that we care about. And it's even more of a pleasure to have the opportunity to do that for folks who need our voice, people that we may never meet, but whose lives we can change tremendously with a little bit of advocacy. So I wanted to start by giving you a little bit of background about CARE, the things that we work, and then the things we work on, and then give you an idea of how you can get involved with our political advocacy. So CARE was founded in 1945. We started by literally creating a care package. So when you think of getting a care package at camp from your grandmother or your mother that's filled with cookies or brownies or whatever she happens to send you, that was actually a box full of basic essentials food to be sent to Europe after World War II, and that helped people kind of get their lives together. It was an emergency response for those who had survived the war. So now CARE continues to do emergency response, but we also look at the root causes of poverty. What is it that gets people into poverty? What is it that creates a cycle of poverty? And how do we get people out of that cycle of poverty? And when you look at poverty around the world, you see that women and girls are disproportionately affected by poverty. Oftentimes, they're the last ones to go to school. They're the first ones to be married off and not have the opportunity to pursue their own interests in education. When food is scarce, they're oftentimes the last to eat. Same with medical care. But at the same time, they are the mothers of families and communities. And so research has shown that by investing in women and girls, these women are more likely to invest in their entire communities, in their families, and lift themselves and each other out of poverty. So in 2013, CARE worked in 87 countries around the world. We reached 97 million people. And we focused on many different things. Again, we're looking at sort of the life cycle of a girl and everything from birth to motherhood on to starting her own business. And of course, women aren't sort of isolated creatures in society. In order to bring them up, those that are around them are also important. So we do work with men and boys and community leaders to help find opportunities for women to improve their lives and the lives of their family. So as I mentioned, I work for CARE's Policy and Advocacy Unit, which means that while my colleagues are around the world giving direct aid and helping women in these programs, my job is to really create an awareness here in the United States about what we can do and what the United States government can do with our foreign aid programs. While we do have foreign aid, it's important to continue to invest the amount of money that we have been investing, but it's also important to make sure that the programs that we are implementing are helping and are the most effective and efficient possible. And with CARE's experience of many years of working in the field, we feel that we can really bring a lot of expertise to members of Congress and help them make changes that are going to help improve the work and the people that we serve. So right now we're working on a few different pieces of legislation. Throughout the years we've worked on many different issues, and I have them listed here. We're looking at issues of gender empowerment, maternal health and reproductive rights. Part of this is about educating women about how to care for their bodies during pregnancy, but also giving them the opportunity to space births if they choose. There are many women who wish that they had access to contraception and can't get it for many different reasons. And this includes women who are married and who already have large families and want to be able to serve the family that they have, and unfortunately can't get the contraception that they need. So that's one thing that we're looking at as far as legislatively how the United States can really create programs that are going to help women with all of their needs. We're looking at food security issues. For a long time, the United States has had the practice of monetization, which is the practice of taking essentially U.S. grain and in an emergency, or U.S. commodities in an emergency, dropping that into communities that need assistance. The impact of that is we're sort of sending all of this free food, and the local markets then are not able to strive. And local farmers oftentimes are not able to sell their own goods. So that's one thing that we've worked on for a long time. We've had some success in changing the way that we do food aid, so that instead of sending these commodities, we're sending training, we're sending cash assistance so that people can buy from their local markets, and after an emergency, really start to build up the economy again. What did I miss? Sexual and reproductive health. So one thing that's not on here is violence against women, and that's another legislative piece that we've been working on for a long time. So the last thing that I just want to mention to you is how you can get involved. Here in Miami, we are doing advocacy directly with our members of Congress. We're meeting with members of Congress who sit on the Foreign Affairs, Budget, and Appropriations Committee. And there's actually a lot of representation from those committees here in South Florida. Alex and Betsy do a wonderful job of sort of leading the charge to make sure that we can meet with these members as frequently as possible and really bring these issues to their attention. So we have that opportunity here in Miami, but we also go every year to Washington, D.C. We spend the first day that we're there. It's a 2-day conference that we have, and we bring people from around the country. And the first day we spend time learning about these issues in a little bit more depth than I've talked about them here. We learn how to lobby, how to talk to our members of Congress. We learn about the legislation. And the next day, we go up to Capitol Hill and we meet with our members of Congress. So that's happening this year, May 12th and the 13th. And I just wanted to share with you that we have gotten, from Delta, we have gotten a really generous scholarship fund to bring one person from Mario Diaz-Balart's district. And I believe that Mario Diaz-Balart actually represents this area. So if you live close to campus, you're probably a constituent. So it would cover either a shared hotel room or airfare to go to Washington, D.C. to participate. And if you're interested, I just wanted to invite you to send me a letter of interest, and I will be selecting one person from this area to receive that scholarship and attend the conference. That's my email address there, so if you have questions or if you want to just submit a letter of interest, please feel free to do that. That's it. Thank you.
So I just want to kind of open it up. Does anybody have any questions, any thoughts, anything from your studies that would, do you need a mic?
No, I'm here. Okay, thank you for coming here today to spend some time with us. It was a great to hear from you. So I'm kind of interested in economics, and my question is kind of has an economic change to it. So we all want foreign aid from government to increase, but for that they'll need more taxes, more budget. And if we tax, they will have to tax the wealthy people, and that will in turn maybe reduce the donations from the wealthy people who are philanthropists and all. So what are your opinions about how it will affect your operations, like funding from government versus funding from the wealthy people? And these are kind of on a very conflicting road, because they can all go together up at the same time.
Well, I'm not an economist.
Yeah, just
I mean, all I can give you is my personal take, and these other ladies can give theirs. I mean, I think that there could be a lot of shifting of where money is delegated. So, do we really have to have X amount of million going into
Military spending.
Well, but that's a different budget, so that is not under the auspices of foreign aid. So, but within the foreign aid budget, there are probably a lot of shifts, and like we've spoken about, actually researching, doing the research, placing it right, making sure these programs are efficiently and successfully funded. And I mean, that's just my opinion. I don't think you have to raise taxes. I think you have to make qualified judgments of what you want to do with it.
Hi, my name is Ellen, and I work with Advocacy, but I feel like I could speak for all of us. I've been going to Congress for 30 years now, and there's a pool of money. So who speaks for the people who can't speak for themselves? There are no advocates. So it's not so much about more money as about priorities. When you have a personal budget, you make your priorities, what's most important, what's next, and so forth. And we want to make sure that the issues that they're talking about, which are, first of all, measurable and have, I think everything that we advocate for has a measurable way of seeing if it's effective. There's a lot of money that just goes down a hole and you don't know where it's going. So you can really make the case. I feel like we have to be, in some ways, really great debaters in that sense, to say this is a priority and it has an impact on everybody, because poverty, even if you're not thinking of the humanitarian aspects of it, in terms of reducing war, providing opportunities for everyone in the world. Why does everybody want to come to the United States? Because we have education, health, and economic opportunity. That's why all of us are immigrants from somewhere, unless you're Native Americans and maybe unless you were slaves. But there are more opportunities here. People come here. Why shouldn't we help stabilize countries so that people have opportunities in their own country? And I think that makes a very good case for why the money should be put in that direction, but you don't need more money.
I was just going to point out that in the last few years, we've seen a decrease to the amount of money in this budget, and so even just advocating to keep it as is something that's worthwhile. And again, sort of following Betsy's lead, I think that so much of the legislation that implements these programs is very old and it hasn't been revamped. And part of the problem is that there's not political cover for legislators to get involved with foreign aid. They don't want to touch it at all because it looks like they're wasting taxpayer money. And so that's really what we're advocating for, is to create that political cover for them so that they can so they can make the changes necessary.
I'm going to add just a few thoughts to that. I don't necessarily see it as two areas that are kind of in competition, to be honest with you. I think that globalization is opening up markets and economies in a way that we're still trying to wrap our heads around. Markets in China are affecting us here. Like markets, you have like the development of the developing bank like BRICS coming on board. So I think like in terms of economics, the landscape is changing. And I don't necessarily think that if you allocate to one, it's at the peril of the other. In fact, I think that this new way of doing work is really probably incentivizing, I want to say like the more entrepreneurial people, like opening up new markets and being more socially responsible in the process of doing it. So I think, it's interesting when you think about like the economic aspect of it in that way. There was another statistic that I came across, and it said $161 billion of private capital is poured by investors in the search of commercial success. And I don't think that's going to reduce. I think actually this innovation or like a commercial aspect within a global economy is flourishing.
Hi, thank you for coming to speak to us today. So my question is going to involve China. Basically, with China's growing prominence economically, they've been investing in lesser developed countries a lot, especially in the Caribbean. They're in lots of different countries doing different projects. So my question is, with their growing prominence, and some argue that they are superseding and outdoing the U.S., why does it need to be U.S. dollars?
Why what?
Why would it need to be U.S. dollars giving aid to these countries when nations like China are stepping in now?
Well, the U.S. isn't the only one that gives foreign aid. Most countries in the world give foreign aid to all kinds. I mean, I think the United States sits at like number 9, something like that, in the level of money that we give to foreign aid. Number 9. We're the wealthiest.
Yeah, make just add one thing to that. We rank down actually in comparison between the percentage of our GDP per capita with other countries like Norway, for instance. However, in sheer numbers, the United States is more than double, probably 3 times the nearest other country, which is probably Japan right now. But one thing is, China gives out money for commercial reasons and other reasons. China also single-handedly accounts for 20% of all the poverty in the world. If you look at the number of people living under the poverty level between India, China, and Nigeria, you've got 75% of the poverty in the world in those 3 places. Pretty remarkable. I do think, though, that China is starting to step up with environmental considerations and looking abroad. But yeah, they should step up too.
I personally think China goes into a lot of these countries like the Caribbean, as you say, reaping their goods, not in assistance for their people. They're after their coal or their minerals or their water rights. This is what I have seen. Maybe they're coming along with some humanitarian assistance, but we'll have to wait and see. And for me, it's the right thing for this country to do. We are very wealthy in this country. We have all pretty good lives in this country, and to give back the slight amount that we do, to have the country know that we care, have the world know that the American people really do care about everybody else in the world.
And I think it's also important to loop this into the first question. I don't know the exact statistic. I think it's something like 9 out of our 13 largest trading partners used to be recipients of foreign aid. So if you look at, for example, CARE started in Europe. We're not giving aid to those countries anymore. Now they're our allies. They stand with us in the world. And so if you're looking at who's creating those relationships and who will be our trading partners down the line, it makes sense for us to continue aid to continue that cycle and have trading partners down the line.
Right, like Maria is saying, these countries are graduated out of loans. I mean, they all of a sudden, they're not poor anymore. They're now the ones shipping and paying, and everybody's a developed country, as I said in the beginning. Who wants to be called a third world country? Nobody.
How do you think that we're okay spending $250,000 on one Tomahawk cruise missile, but not okay spending an average of $5 per person per year?
Same thing with education. It's very hard to provide this quality of education. You have to have, big sales for high schools,
I always say to my husband, I want one of those 515 fighters. He says, those have been outdated for years. I said, give me the money it costs to build one of those, and we could possibly pay for our entire foreign aid budget, humanitarian side.
And I also think that it's an important sort of point about advocacy and lobbying. I mean, we are a country built on discourse. The point is that we have differing opinions and that we have the opportunity to speak up. So absolutely, if that's the way you feel, raise that in this forum and in other places so that that conversation continues to happen.
I'm going to add something to that really quickly. The work that I've been doing has been abroad. And I've had results on my radar for a few months now, and I've recently come on board, and I have to tell you that I can't be more excited and happy about it because somehow the global work is now connected to our work here, and that's a very fulfilling feeling. I'm an immigrant. I came from a third, world, country, and so and many people can identify with that here in Miami. I think that there's got to be a fundamental belief that as human beings we deserve basic certain aspects in terms of enjoying life, health being one of them. So just to kind of gloss over that question a little bit.
I was going to ask, do you think that the solution will be spending more as a government or spending more individually per person as a private citizen? Or some kind of combination of both?
I think it would be both. I think government has access to viewing a situation in a way that a citizen doesn't. But
it depends, on the organization. CARE, because they work in country, actually would love to have your money, to help. I mean, this huge cyclone just hit, right? So they are really reaching out to people $1 or $2 or whatever you can spend. Results is strictly an advocacy organization. The only money that we ever ask for is a small membership fee to help with people or something. The One campaign, strictly an advocacy organization. They collect no money at all. So it would depend upon, it's like, well, do you give to the Red Cross? Well, yes, that money's help, yes, on all ends.
I think they might fire me if I don't put a plug in right here. But after the economic crisis, every organization has been suffering, and CARE, has seen a lot of significant changes in our ability to reach as many people as we've been serving. And so I think that continuing to give money to organizations that do this work is extremely important, but also to continue to talk about it so that those that are making powerful decisions feel like they can make the right decision. I think both aspects are extremely important.
saying in terms of the advocacy, especially right now during appropriations. I mean, we're asking for money. You know that saying like time is money. That time, even if you're not giving your own money, but the fact that you're doing that advocacy piece, that's really helpful, and it really would translate into that. So
Right. You have to. You probably all guys already know, but not every congressman doesn't know everything. It is impossible. It's just impossible. Each congressman has specific staffers. That one does education and one does foreign affairs, and so we reach out to those legislative assistants, the staffers, that work particularly on the issues that we work on, and we basically bombard them every month. And it's never enough, especially at this time when we're asking for this money. We have five members of Congress throughout the state of Florida, throughout the entire state, that are on appropriations. I mean, we go in there, and they're the ones to go after. They're the ones holding the purse strings. So.
yes.
Hi, my name is Stein. Thank you for coming and enlightening us with so many facts and interesting information. My question is, it has to do with politics involved with the distribution of foreign aid. In the past, there has been a high level of politics within how foreign aid is distributed to countries. Will there be a continuation of that, trend, or will that trend decrease? And how do we decrease that trend?
I'm gonna chime in here.
Yeah.
And I'm not a foreign aid expert by any means, but I'm gonna tell you a little bit about what I'm seeing in the landscape right now. Because of the internet and a lot of people being plugged in, there is this craving of more transparency where funding is being allocated. And the more people are questioning, where the funding is going, how is it being, how is it being allocated, how is it being used, what impact is it making, it's really creating friction, in terms of how much transparency is placed within that within the industry, let's say. So I think that because of that, that's probably gonna. I don't think it's gonna perpetuate, greater political. I mean, it's hard to say. I'm speculating here, but I think that is going to be a driver for a different kind of conversation in terms of the politics that are involved. That sense of transparency, that people are being very vocal. I hear many organizations that are at the forefront doing work, and they are getting that from the citizens that they that they get funding from.
So it's clear that you're all working towards very similar, if not the same ends here from different angles. And so my question is about the collaboration. Clearly, you all collaborate. You're here together. You're locally here talking about what you do as separate organizations together. And so that's really neat that even though you're separate organizations, take separate strategies, you're all here together and you know each other. I'm curious at more of the top level strategy planning at the national level, at the actual people being impacted on the ground in these different countries, how the coordination looks like in terms of you're going to Congress. Is there any coordination at that level of they're just all hearing from you separately, or you get together and talk in terms of measuring who's helped in what country and what city? Is it all kind of piecemeal of, well, we're helping people here, or is there strategy there? And as a semi add-on to that question, I think it's interesting that CappSci is new, and so when someone comes and decides we're also going to want to help, is it difficult to come in as a new person and get attention and money from the people that have been giving attention and money to different areas for your organization, and then to coordinate with the existing people in terms of, well, there's already people helping in this country, in this city, and we want to help and do, yeah.
Can I start with the coordination piece, and then maybe she can chime in with the funding piece? There's a tremendous amount of coordination and collaboration. My boss was one of the, I believe, founding members of the One Campaign, starting that campaign. And the idea of the One Campaign was to really make sure that that there was collaboration. And so our CEO sits on different boards. She works with other organizations to make sure that our missions are aligned and also diversified, so that we're picking up different pieces and sort of pulling together different sectors. So I think in the United States, that's sort of how that looks. There's a lot of collaboration. Also on the ground, it's very similar. In emergencies, generally what will happen is there's a coordinating body, and different organizations will go in that have a ground game, and the country or the emergency will be split up. So CARE will do sanitation kits, and then another organization will bring the housing materials, and another organization will do some sort of training. So it is in collaboration with other organizations and split up very clearly, so that there's an idea of who's providing what.
If you go onto the USAID website, you will just see how it has changed. I'm sad to see Rob Shawley. Let's see, maybe your illustrious leader might take over his position. But you will see a lot of transparency there, a lot of numbers, a lot of collaboration. And I think it's a lot more strategic than it used to be.
May I make one comment about that? There's also one thing I always like to throw into these discussions, because I at one time was a graduate student in international relations. I had no clue that there was this vast world of employment opportunities out there, working with thousands of NGOs and some for-profit groups as well, that are all collaborative organizations of USAID, of the State Department, of other Department of Agriculture, working all over the world. And they all have amazing job opportunities. And anyway, I just wanted to put that out there, that it's not only just helping advocate, it's also that can be your future as well.
Right. I think like Bill and Melinda Gates Foundation does an extraordinary job of doing all that collaboration, reaching out and bringing people in.
I have to say, as a new kid on the block, it's been an interesting perspective. We bring in, as part of the prize process, people that are established in the field. So we definitely have collaborations in terms of the expertise to guide our selection for who will win a particular prize. And recently, I had the opportunity to go with Betsy actually to one of these appropriations meetings, and I last year had the opportunity to travel to Pakistan to oversee the rollout of the initial project that we funded. So I have, I got to see that on the field, and this year I'll be seeing, the other projects. But when I sat on the appropriations meeting, she's very well versed in the advocacy component. And every time she was speaking to that point, I had examples of what I had seen on the field. And I would say, well, that makes sense because of this, and that makes sense because of that. So seeing that very natural sort of collaboration taking place has been, pretty rewarding. And I think, we're fairly new, so we're figuring out our fit in this landscape, and, we're being more strategic in how we approach this. But definitely what we do is fundamentally collaborations. We are here and managing projects in Asia and Africa, so we really rely on those relationships that we create.
I always feel bad taking the last question. We are after our hour, though, so I'm sure that there's time to chat for a little bit afterwards, but I would like to thank all three of our panelists and everyone for participating.